Then acne vulgaris. I think this is the one that is commonly we call pimples, for example. Acne vulgaris. So very common chronic inflammatory dermatosis. Dermatosis is basically a lesion of the skin. So we talk of dermatosis, found predominantly in adolescents in both sexes. In adolescents, and of course, sometimes it continues on. Even your age group, for example, many of you probably are within that range. So you are likely to have a lot of acne vulgaris, pimples, and so on. So it's more commonly on the face, the upper chest, and upper back. So it's related to physiologic hormonal variation. Remember, around puberty or an adolescent, there are changes in hormones. Probably for the male, there is more of testosterone. For the female, more of estrogen being produced. So there is that physiologic change, hormonal change. And that is what is thought to cause a resurgence of this. So mostly the condition affects the hair follicles, the opening of which is blocked by keratin material, resulting in formation of chemadods. You know, the one we talk about, blackheads. Yeah, that actually these hair follicles, you remember the hair follicles, so when it is blocked, yeah, by keratin material, there is accumulation, of course, of fluid that will have come out and so on. And so that's how you end up with pimples. Yeah. So it results into those blackheads that block. So you end up with that swelling because the material was supposed to come out, the sebaceous glands, the sebum that was supposed to come out may be blocked. And so you end up with those pimples or the acne vulgaris. And you can see a picture there, not very clear though, but you can see is somebody with the acne vulgaris, the pimples on the face. Then we have fungal infection. Of course, infection, also fungal infection is quite common, affects the skin. It can affect the nails. It can affect the hair. Yeah. So this is more common in warm, moist areas of the skin, such as the skin folds. So where there is a lot of skin fold and between toes, and also in immunocompromised individuals. So people who have immunity, low immunity, they tend to develop fungal infection of the skin. Yeah, so ringworm and tinea pedis, these are superficial skin infection, fungal infection. So of course we talked about, when you talk about ringworm, I've seen people being given antihelmin, that is drugs that treat worms, thinking that it has nothing to do with worm. It's just the name indicated ringworm because it appears like a ring, a circular ring. And that is why this name ringworm came in. So it has nothing to do with the worms. So it will not help to treat somebody, give somebody drugs to treat worms when actually it is a fungal infection. So it can affect any part of our body. It can affect the scalp. So when it affects the scalp, we call it tinea capitis. When it affects the feet, we call it tinea pedis. When it affects the groin, that is around the scrotum, the vagina region, that area we call the groin, we call it tinea corporis. So tinea pedis also, that the one that is affecting the feet, sometimes we call it the athlete foot. That is the layman's name that we sometimes. So when you hear of athlete foot, is referring to tinea pedis and tend to affect the skin between the toes. So between the toes, it tend to affect that part. We call it athlete foot. That is still tinea pedis. And usually tend to spread by direct contact. That means if you have come in contact with somebody with this tinea, this fungal infection of the skin called the mycosis, it's likely to affect you. And then very common, we call pressure ulcers. Of course, the way we treat this fungal infection, you use antifungals. There are drugs we call antifungals. I think in pharmacology, you will be taught about antifungals if you've not already been taught. Things like fluconazole and so on. So there are some that are topical. You can apply it as a cream or maybe an ointment. Then there are some you take orally. There could even be some that you can be injected. So antifungals. So you, especially for this one, mostly you use topical, where you apply maybe twice a day and or so on. So you use basically antifungals to treat fungal infections.